So what do you think of that job fair today?
I thought it was interesting. I felt like I learned a lot.
Yeah, I definitely learned a lot about those IOM recommendations. Which one really caught your eye?
I would have to say number 6. Basically, it was ensuring that nurses engage in lifelong education.
Yeah, that was good.
What about you?
I thought recommendation number 4, which is to increase this associate nursing to increase their education to get their bachelor's for 2020.
Okay.
That was very interesting. The American Association of Nursing wanted all the lowest level education to be the bachelor because they think that would improve client care, management of the hospital, and other things. I thought that was very, very key.
Well, I feel like that would definitely make sense. Of course, bachelors have more education than associates, which, of course, is just the lowest education.
Yeah, but the problem is to get the associate nurses to go back to school to get their bachelor.
What's the problem?
The problem is that they have families or their tuition, how much it costs. I mean, if hospitals help out to get them motivated to go back to school, then we would have more than 80% going to get the bachelor.
Yeah, money is always an issue in families.
But what about recommendation number 6 that you were talking about?
Well, the National League of Nurses proposed that nurses, it's kind of a little bit close to yours, but nurses and nursing students continue their education past their bachelor's and associates. Basically, you always want nurses to continue on learning because in the medical field, you never stop. There's always something new that comes out, something that you need to be educated on.
Yeah, there's always more to improve, and I think we should start looking into going to, the nursing field, because I think that's the one that's mostly growing and showing how everyone is trying to motivate us to get their bachelor and get the highest education. I think that would be the greatest.
Yeah, definitely. I do feel like with nursing, it's, like I said, it's never ending. There's always, like the FDA always comes out with new drugs, and if you were in the hospital, obviously you want a nurse that's well educated on the medication because you don't want them to give you medication that's been recalled or bad side effects, and you want one that knows what drugs go together, which don't. In the hospital, you also want to be cautious as to, nowadays you hear about nurses, patients always getting sick in the hospital, and that's lack of care, lack of, sometimes error, basically. Really, it's nurse error or just hospital error, and if we can reduce that, benefits the patient as well as the hospital.
And also, going back to my, recommendation, RNs and DSNs take the same test, but DSNs are more farther educated just for that, to care for the client, to make sure they're not doing the wrong medication, and to have better interaction.
Yeah.
We're caring for the client, we're doing stuff for the client, and we want to make sure that we can be the best we can.
Definitely. Of course, the more education you have, the better care you have. So, but I definitely feel like, one of the things that, some of the things that the recommendation also mentioned was that, in each nurse's field of study, there's always new research. Like something new comes out about, for example, Alzheimer's, something new comes out about it. They always have constant trials. And as a nurse, you also want to be educated in that. You want to be educated in your field of study, and that helps you become a better nurse.
No, that's true. I totally agree with that. So yeah, I guess we learned a lot on that job fair today.
Yeah.
About recommendations and.
How do you think? What are other things that you think that would get nurses to push forward and get their bachelors?
Definitely to show that education's out there. It's affordable. There's many ways, like financial aid and ways to cope with the payment. And just know that everyone is there to help you and support you throughout the way. And just know that you're getting the best education to help the client. And that's the whole point of being a nurse, is that you want to be there for the client and make sure they're having the right care and just making sure that overall well-being for that client is pushed to the highest level.
Yeah, and that definitely shows in your care.
Yeah.
So I definitely feel like if I was in the hospital, I would want to be taken care of by a higher educated nurse than somebody who's brand new and who's, got just an associate's, because I feel like, that's not something that, that's a big impact in your care. That could, you could walk out with something worse than you came in with, or...
And there's so many diseases now in the hospital.
Yeah,
like
exactly.
Staph and, all these other hepatitis and everything that's out there. You want the best care you can get in the hospital. I think these recommendations definitely set, a boundary and a limit to what the National Board of Nursing really wants us to go for.
I definitely think it's an eye-opener, and I had to go back to what you said about, you have new diseases and viruses. Nowadays, it's like every time they come out with something new about, here's a new virus, or not a virus, a new bacteria that they're finding out about. And as a nurse, you want to be well educated on that. You want to know, okay, well, what's this new bacteria? How can we prevent it? And you want to make sure that what you're learning, you're actually applying to your patient care. And that's definitely a key point.
Yeah, and also, the hospitals want to hire higher education nursing with their bachelors, because they want to make sure that they are getting the highest level. Because if something happens to that client in the hospital is obligated to pay for all expenses. So they do want the highest level of education to prevent.
I definitely feel like there's a little bit more trust in nurses who have a higher education, regarding hospitals, because definitely don't want to have lawsuits or anything like that, because just any type of careless mistake, anything little, any type of error, that's just the hospital's at risk, and you definitely don't want to bring a bad name to the hospital.
No,
you definitely don't. And, you've heard about a lot of hospitals around, and that, somebody could have, most of the time you see in the hospital where somebody was taken care of poorly, they came out with something terrible. My coworker told me about how, her nephew came out with, he was born and he was in the hospital because of a staph infection. And she felt bad because her sister was paying attention to her own child every time, didn't go back to work, and that really affects that family of that patient, because they feel like they can't trust those nurses to care for their child as a mother would, So as a nurse, you definitely have to have that heart. Even if you have to care about your patients, and that involves, if you care so much about your patient, then you're going to care enough to get educated to take better care of them.
So I think these recommendations really pushed us to know exactly what we have to do.
Definitely.
So that helped.
Yeah.
Great. So what do you thought of that job fair today?
It was really interesting. I learned a lot about the National League of...
What?
Because I could see... No, you were laughing. Stop laughing, because you get me there. I could actually see it.
So which recommendation really caught your eye?
I'd have to say number 6.
Whoa, tell me about number 6. What is that?
If we just recorded us talking, we'd actually get it done. Stop! He's serious.
Woo! Mama McCullough, this is for you. We should do a bloopers afterwards. Okay, anyway. So what do you think of that job fair?
Jordan, I don't love you to laugh. That's all. I already knew what I was going to say. I
wonder if you just know. I'm
break it before I even get going.
Jordan, why don't you tell us about recommendation sex? Six.
Return to Stuart. The robo. Escalator. Elevator. Moving floor. Okay, stop. Any step. No, that would hurt my. That would hurt too bad.